Good afternoon, Chairperson, learned audience. Gut-brain axis, food as medicine, as Madam introduced, with associations in UK, in Europe, Croatia, France, myself, Dr. Venkata Narayana Joshi, and Dr. Suresh Swarnapuri have taken up a pilot project on the virtue of understanding the gut health perspective to growing children. I am also working with gentlebirthmethod.com, where antenatal, postnatal, neonatal care is being done according to Ayurveda principles. And my slides showing upon the relativity of the children should be used as a tool for developing and understanding the brain, gut, in conjunction with the taste. Why taste? Professor late Dr. John Money in 1989, the Johns Hopkins Medical University has postulated brain maps, food maps, and which are going to be fixed into the new life from the 0 to 1 year age group, from the 1 to 3 year age group, and 3 to 7 year age group is the biggest change where the taste buds and the brain register that Ayurveda's approach from gut-brain axis, survey api rogau sutaram udaranicha, understanding the significance of epigenetics, ahara vidhi vishesh ayatanani, ishtavarna rasagandhopeta. This is the biggest transformation for the genetics and genomes. Genomics going to be in the study with this pilot project analyzing how the young brains get tuned for the kind of the taste. This has triggered me in my observations when I was with my grandchildren born in National Health Service in London hospitals. I wondered to see postnatal mothers with their breast milk samples kept in the refrigerators with multicolors. Where Ayurveda, you know, the quality of the nourishment.
So the copy of the PPT wasn't submitted.
Submit किया है मैंने, लैपटॉप में है, देखिए आप करिए, लैपटॉप में है, मैडम देखिए. Anyway, I have submitted the PPTs, but unfortunately, I'm not able to show here. I don't know why. Anyway, I'll talk like this. So my interest was, when Ayurveda said about the quality of the breast milk, you understand how significant the conch shell deep down into the oceans, how cool it is, how white it is, and a drop of the mother's breast milk kept into the distilled water, disseminating the ways and patterns, or a simple observational organoleptic methods of testing the quality of the breast milk from the coolness of the mother into the nourishment of the babies. Unfortunately, I saw these things that even the mothers at home with the nurturing care of the babies, nurses will advise breast milking is being done, pumping is done and kept in the refrigerators because mothers are working. And this is the mother and baby care. We understand how significantly science coming to the mother and nesting and the babies delivered at home. Now we can see in London, most of the mothers would like to deliver as a natural methods of the pool birds at home with assisting. I am assisted with this so many celebrity families from Hollywood to Bollywood and as well as to the royal families. The deliveries being conducted under the natural methods of Ayurveda theories. My wife sitting over here, she was allowed to chant the Lalita Sahasranama, Vishnu Sahasranama, so many things in the delivery room. I started thinking about that, how children are born with the innate inborn genetic deficiencies of the skin diseases. We understand the skin diseases coming from shakas, that is from the rasa and rakta, and the significant amount of the toxins loaded from mother into the growth of the embryo, and that is born children with the skin diseases. So many mothers used to come to me with the twin children under the 1-year babies. We cannot even give any medications for children and give the medicine to the mother for purification of the breast milk to the mothers. When they are not weaning, in the weaning periods, what can we do to the children? And the external applications, I have given Imcops Sindura Dilepam, which was outstanding in the external applications to remit partially. No any cream NHS was supporting for the skin diseases. So many mothers and children are benefited by the kind of the nutritional advices what we are giving through gentlebirthmethod.com, Dr. Gauri Mota. And these theories of the brain maps, food maps, developed by this Johns Hopkins Medical University way back in 1989 when I was there, and started working with the schools. The primary school like Krishna Avanti School, Hindu Sanatana Dharma schools in London, with the consent of the parents, derived the questionnaire, indirect methods of understanding children's lifestyle, and believe me, the sugar, the jellies, the maida, the potatoes, these are the things which are confectionery, processed food, baby foods. It's a pity to see that how children are exposed to these unhealthy food habits. So I started campaigning with the community health services. We have a community interest company. So in the hospitals, on the multi-faith cultural activities, in the NHS hospitals and trusts, and we go there and educate the parents. The significance of the taste should be developed from the childhood. That Ayush Ahar is now much prevalent to be traded now. I was working with the Sakshi groups of the nutritional supplementations. Now the Sakshi group in London supplying 1 million antenatal food kits. So this is the way the prevention for the child's health into the futuristic generations, not to suffer from the nutritional gut dysfunctions, which are leading and primarily being found over the skin. So the Rasa Dhatu, we know how clean it should be in the heart. In Ashtanga Hrudaya, you can see the descriptions of the purity of the essence being absorbed from the nutrients, which is something like a submerged in the water. Can you see the sunlight under the water? The spark in the heart, which ignites. Neelatoyada madhyastha vidyullekeva bhaswara nivara shuka vattanvi pita bhasya chanupama. This is beyond the science to understand. Apa santapayate samdeham apata talamastakaha. The spiritual fire into the physiology of the heart, from the purity of the essence, digested being absorbed, from the portal system to the liver, and everywhere in the microcapillaries, that cleanness of the rasa. 50% of that, it goes to the monthly care of the nesting babies and comes out as a waste, as a menstruation. Ayurveda understood how clean it should be, how easy to wash out it should be. The quality is being ascertained. So much is there to offer for the prenatal mothers, and we are all doing through the screening of the parents. In Europe, resorts, coastal side, couples will come and they join for the wonderful feast of the Ayurveda food being tasted. My wife cooks. And that is where the screening of the parents before they conceive, the quality of the essence of the progeny is bestowed by preventing all the dysfunctions and diseases. The primary health care of this gut selectivity into the brains to fixate through the epigenetics from the senses to program into the futuristic level of the healthcare. That is what our integrative protocols of the futuristic model for Ayurveda ancient wisdom into the current existing problems, what we find and see in the society. So that is where I'm working with the Tooting Pharmacy. I worked around with 50 pharmacies around in London. I worked in Cambridge Ayurveda Center. Way back from since 2001 onwards, we are working on this. I have submitted the dossier on the basis of the simple spices and the food as a medicine, how it can be benefited for the health. And that is where I got the immigration being granted under the highly skilled migrant program, ever on Ayurveda credentials to be immigrated into the United Kingdom. So you have to have a vision. This is for especially for the students. Understand the principles of us, our Swastavritta, our Sadvritta, that is what the mental health. Now you understand how much is being spent in United Kingdom on just only the mental health is equivalent to the entire health budget of Bharat nation. That is the biggest problem we are facing and challenges. And recently there was a meeting with the 50 plus consultants Association, British Association of Physicians of Indian origin, with the Baroness Verma, Houses of Lords and Peers, and Virendra Sharma ji from Southall MP, and Harrow MP, Bob Blackman, and so many people were there to make the policy, understand integrative protocols, integrative medicine to define. 2 days of the debates went on. We are trying to bring this ancient wisdom and reduce the budget of National Health Services in United Kingdom with the possible inclusiveness of the non-invasive protocols of the interventions. We already have 2-3 hospitals which are much pro for it. I'm working on it. I've submitted the dossier to the Ayush Ministry. So that is where the support for bringing into the change for the society with the healthy habits inculcated. You understand the quality of the foods which are available in London, they come from all over the countries. Number one quality of the food, supplements and nutritions, vegetables, fruits, everything. But unfortunately, we don't know how to use them. That is where you can see the combinations of the funny Viruddha Aharas coming from the yogurt-based food and fruit drinks. And we are bringing awareness into the communities through the programs and campaigns, visiting the schools. I know the slides are not there, but we try to reach out even to the Department of Health. I wrote it down. And then the schools to get the permission for us to go and have a basic interviews for the children to understand lifestyle changes, how it can be. Simple questions like weekend times, when do they wake up? And school times, they wake up early in the morning. And the variations with their exposures to the unwanted mobiles or the radiations. So we are avoiding all these lifestyle changes being brought from the taste-based. The taste is coming through from the lace. For example, when I said the heart and rasa dhatu, what is that in Ayurveda? Amalaki and the pomegranate. These are the two fruits which comes out outrightly into the circulatory means of making food as a medicine for the children to be a tasty food. And we are deriving them and explaining them. We understand how lemons, green limes, when combined with the old jaggery in Ayurveda, which is a toddy jaggery, caryota urens, that candy, when it is saturated, the multicolor glasses experimented in Germany, exposed to the sunlight and make them to have a saturated liquid, simple green lime juice with the kitul jaggery, which comes out from Sri Lanka. Of course, it grows in India as well. Because it is ultimately the sugars which heal at the level of the cellular protection, and that should be the clean being absorbed into the assimilative point of growing the quality of the rasa dhatu. That is what Ayurveda Madhura Rasa means. The Madhura Rasa, the Amla Rasa, these are two rasas Ayurveda people know. And how do you quantify them? The selection of the quantification, Akashad Vayu Vayu Agnihi, Anyonya Anupraveshitvat, and just to give Akasha 1 number, Vayu 2 numbers, Agni 3 numbers, Jala 4 numbers, Prithvi 5 numbers. And it is as well Madhuratama, Madhuratara, Madhura. And that gradations are being made for the quantification of the assessment. When you have the Prithvi 5 number and Jala 4 number, that's the 9 number will comes to the extensive potency of the Madhura. And then you can see A3 grades for the Madhuratama, A2 for the Madhura, Tara, and Madhura is A. So calculations are being made based on the taste. We know how taste threshold being done. Paramkush Rao, my teacher is sitting here, Dr. Chandola sir, and then my colleagues are over here from Jamnagar. And we have done the taste threshold, Paramkush Rao. And this is what they used, simple methods of the taste threshold experimentations to understand the Madhuratama, Tara and Madhura. And Madhura Amla, when it is combined, it is like a 9 plus 8. It comes, this is like a 5 Panchamaha Prithvi, and the 4 Apudhatu, 9, and then the next is the Amla, 8. So this comes as a Madhuramla Tara. These reasons why, because any plant maturity has to end up into the fruit maturity of the Madhuratama. And before it going to the Amla, that is Amlam Hrudyanam. And the affinity of this Amlatva into the cardiac protection to the healthy rasa formation. That's how the saliva start coming out when you taste the Madhura, Amla rasa. So the selective process of the selective vegetables and fruits and the sources like amla to the thala guda and as well as to the dadima and confectionery preparations, very tasty for the children to be exposed into the Hrudya Dravya Prabhavatmaka Ahara Rasa Dravya Rupantaratvam. That is what the epigenetics, and we are working on it, and with the survey analytical studies, the children are being offered or advised through the parent care. This is the social services we have taken up for the transformation of the gut health into the extent level of the practicality and the utility-based survey analytical studies. It is in the process. We are working with the Indian embassies as well. So there so much is happening. Due to the limitation of time, I think my time is over now. So I understand that this is just an eye-opening for the youngsters to think about how the principles of Ayurveda can be applied into the lifestyle medicine, nutritional medicine. I have already submitted that they are taking personalized medicine, gut medicine from our science. And they got the Nobel Prize for intermittent fasting. We know the value of the Chaturmasa, we know the value of Ekadasi, we know the value of the foods seasonally being given for the detox process, Panchakarma, to the level of the cleaning Rasadhatu, and that is where the Upavasa. But anyway, we are here to transform and bring this practicality into the nation for the oneness and one health and one nation, our beloved Honorable Prime Minister's vision and mission, and where we are working as a part of the little contribution from our associations in UK and Europe. Dhanyavad, Jai Ayurved, Jai Dhanvantare Namaha. Namaste.